What is the autism spectrum? So the autism spectrum, going backwards, there is a book. So in the world of psychiatry, we use a book that is filled with a lot of terms that we use to try to have a common language of what we think is going on with someone. And in order to get a diagnosis, you have to hit like certain criteria. It's kind of like a cookbook, but with there's no food that comes out at the end. There's no delicious cake, which man, cake would be awesome. But so you can go through these criteria, and if you get a certain number of criteria for that particular diagnosis, then we give you the diagnosis. And there's a lot of fervor and emotion about this book. It's called the Diagnostic and Statistical Manual, the DSM. Because quite a few folks feel very strongly that sometimes doctors use that and they'll give a label without truly knowing a person. My approach, and again, your mileage may vary, YMMV, it's on our website, so we'll talk about that later, but your mileage may vary in that I use the book for guidance and a kind of working understanding of what's going on. So it is not hard and fast, set in stone. In my career, I've seen where things can change. A person comes in with what I think is going on, and as we work together and I get to know them better, I actually can shift what I think is going on. And so now that you have that in the back of your mind, as far as how we give a diagnosis or how we label something, there's 5 versions of the book, technically a little bit more than that, but let's just say we're on the DSM-5. And in previous books, they had different groupings of symptoms that pertain to like communication. So sometimes kiddos were having issues with communication, like delayed speech. Sometimes their social interactions were a little bit awkward. And sometimes they would have unusual movements, especially kind of like self-soothing movements. And so they would group them in different clusters. And so that's where, if you've ever heard of the term Asperger's disorder or Rett syndrome, RETT apostrophe S, Rett syndrome. And then there's one called PDD, so pervasive developmental disorder. And then there is another one called autism. Autistic disorder, and so they had all of those in the 4th version, 4TR version. Again, super specific. Well, when they came out with the 5, because we're learning, the DSM is a living document. It can change over the years as we get a better understanding of people. In the 5th book, they took all those things that I just listed, PDD, autism, Asperger's, and they mushed them all back together, and they called them autism spectrum disorder. So they're basically saying that there is a spectrum of behaviors. And so some folks have kind of severe autism. Some folks have mild autism. And autism can be very kind of misunderstood and complicated when you're looking through all the criteria. And so anytime I'm teaching my families, I teach about, I give the construct of autism being a social skills disorder. So it's a social skills deficit, meaning that if you fall somewhere in that spectrum, you have a very difficult time with social skills. So sometimes it's as nuanced as not understanding sarcasm or missing intonation or inflection in other people's voices. It could be really poor eye contact, or and when I say poor eye contact, it goes beyond kind of social awkwardness, because all of us can be a little awkward if we're in a situation where we're not comfortable. For folks with autism, they're not always necessarily uncomfortable. They don't recognize that there's a miscommunication going on. So, for example, a person with autism could be in a group and everybody's like, ribbing and riding each other. Oh, your mama looks like this, or, oh, your hat looks like that, and the person with autism wouldn't understand that these are analogies. These are not direct attacks, right? So that nuance is gone. That social nuance is gone. Some kiddos or some adults on the spectrum will have stereotypic movements, which are repetitive movements that happen. Most times they're self-soothing in nature. So it could be, rocking back and forth. It could be hand flapping. It could be tapping. And then sometimes they will have communication deficits. So either they are delayed in their speech, like trying to learn to speak when they're younger, or have speech articulation issues. And all of those in different amounts and different severities can show up for a person with autism spectrum disorder. And so it is, we don't know where it comes from. We think we might know. So there's research going on about genes and all sorts of stuff, but for all intents and purposes, we don't know. And so there is no medicine to treat autism. In fact, or instead, you concentrate on the symptoms. And so for a lot of folks with autism, ADHD and attention is a big issue. Anxiety is a big issue. Oppositional defiance, meaning I want when I want and I wanted it 5 minutes ago, that can be a big issue. So all of those things kind of are baked into autism for a lot of kiddos. And so my job as a child psychiatrist is I get to tease all those things apart, and I get to teach all of my parents and my people about that. And when I'm working with adults, it's the same thing. I get to work directly with the adult to see their blind spots and to teach them how to manage their blind spots. And so autism is something that can get better. And so I always want my parents, and I just want the general public to know it can get better. It is not a terminal illness. It is something that you can manage and live with. And with enough training, especially social skills training, you can live a very balanced life if you choose to do so. So that is autism spectrum disorder.